All right, welcome back to ABA Exam Review. Today we're continuing our BCBA exam practice question series where we're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our proven study materials. When you pass, let us know so we can include you in our Sunday shout out. Work hard, study hard. Let's get to our questions. Question 1. A behavior analyst begins a functional communication training procedure for their 4-year-old client. The behavior analyst instructs the behavior technician to put non-functional communication behavior on extinction and to reinforce on a FR2 schedule to start. The behavior analyst has a plan in place for thinning the reinforcement schedule once the learner starts to exhibit the desired behavior. How would you evaluate this plan? A lot going on here. Long question. What we don't want to do is read that long question and then immediately jump to our answer choices. We need to do all of our work in the question, analyze the question, and try and make a prediction. We don't want to be bouncing back and forth, answer choice to question, question to answer choice. Let's do all of our evaluation first. We want to think about this behavior analyst's plan. We are doing a functional communication training procedure. They're doing extinction. They're reinforcing on an FR2 schedule, and then they're going to thin the reinforcement schedule. What do you think about all those components? That's the question you have to ask yourself. A, the plan looks good and is ready to implement. Now, I would disagree. I have an issue with reinforcing on an FR2 schedule. And the reason is when we first start functional communication training, we need to be continuously reinforcing every instance of that response. Remember, continuous reinforcement is great for strengthening and building up skills. And especially in FCT, when we start, you need to be continuously reinforcing. So if you look at B, the behavior analyst should begin with the CRF schedule. That is what the issue is here. The extinction procedure is not a problem. The thinning isn't a problem. It's how often we're delivering reinforcement. If we look at C, the behavior analyst should not use extinction in conjunction with the FCT intervention. Well, it's just the opposite. Cooper recommends extinction or timeout in conjunction with FCT. The extinction procedure looks fine. And then D, the behavior analyst should have begun the FCT intervention sooner than 4 years old. Well, there's no way to know. We don't know anything about the history. We don't know anything about the client, any of that, right? So we can't just start making assumptions. You need to avoid assumptions. What we know is they want to use a fixed ratio 2 schedule at the beginning of an FCT training procedure. When in reality, what we need to be doing is using a continuous reinforcement schedule whenever we start FCT. So how would you evaluate this plan? Well, you would say the behavior analyst should begin with the CRF schedule. Extinction is fine. Thinning is fine. Change that piece, and it seems like they're good to go. Brad wants to quit smoking. He understands that it is bad for him, and he knows that it eats into his savings every month. He can go a few days without smoking, but then eventually smokes when withdrawal symptoms kick in. The withdrawal symptoms function as what? Brad is a smoker, and he wants to quit smoking. He knows it's bad for him. He knows it eats into his savings every month. He still can't quit. Every time he goes a few days without smoking, withdrawal symptoms pop up, and he starts smoking again. Those withdrawal symptoms are doing what? So it's clearly a reinforcement and punishment question. And you have to ask yourself, our learner, in this case, Brad, our subject here, is that behavior increasing or decreasing? Well, in terms of or relative to withdrawal symptoms, his behavior's decreasing. The behavior of doing whatever else he's doing besides smoking, of not smoking, right, is decreasing. So the withdrawal symptoms are causing him to smoke. In other words, his behavior, right, going without smoking is decreasing. And that's important, right? We're talking about the behavior of not smoking here. And that behavior is decreasing. So don't get it confused, right? So if his behavior is decreasing, then withdrawal symptoms have to be punishment. We eliminate A and B, it's not reinforcement. Then we ask ourselves, are the withdrawal symptoms added or taken away? Well, they're added, right? The longer he goes without smoking, the more withdrawal symptoms start to pop up, right? And so these things are being added, right? Causing his behavior to decrease. So when something is added that causes behavior to decrease, his withdrawal symptoms are functioning as positive punishment. Now, if you do enough reinforcement and punishment questions, these are going to become second nature to you. You might not have to go that deep into each analysis. But when you're just starting out, you need to take your time, right? Our only goal is to answer every question in front of us correctly. If you do 5 questions and it takes you an hour to get 5 right, that's better than doing 20 questions and missing 10 of those. I promise. Accuracy creates speed, not just trying to go fast. So the withdrawal symptoms function as positive punishment. You are a behavior analyst working as a developmental coach for people who want to improve their lives. If you primarily use self-management techniques, which of the following scenarios would be incompatible with your program? So this is really a self-management question because we're asking about you who use self-management techniques. And what the question wants to know is, out of these scenarios, what are going to be incompatible? Meaning, what can't you treat using self-management? And self-management is very misunderstood by behavior analysts. Make sure you understand what self-management is. In this case, let's look at each scenario and ask ourselves, could we use self-management to treat it? A man tells you that he has a bad habit of eating fried food late at night after going out with friends. Can self-management treat bad habits? Certainly. Bad habits can be treated using self-management, straight from Cooper. B, a woman tells you that she has a personal goal of writing 500 words every day. This sounds like a perfect behavior to treat with self-management, right? This personal goal, it's achieving something every day, that's holding yourself accountable. B would be great for self-management. C, a PhD student tells you that they want to complete their dissertation by the end of the year. So difficult task, another personal goal. They're going to need self-management to pull this off, right? This PhD student is going to have to learn self-management techniques. So realistically, you could break bad habits, you could achieve goals, you can achieve difficult tasks, you can do all these things with the help of self-management. So in this case, are any of these scenarios incompatible with your program? Well, no. So our answer is going to be D. All of these are compatible. You can easily, again, treat bad habits, you can accomplish goals, and you can achieve difficult tasks. A young girl scratches her own face 3 times per hour every single day at school. The scratch is now starting to bleed from repeated contact. The function of the behavior is automatic and to gain attention. Which of the following would not be an acceptable extinction procedure? Now, we know extinction is withholding reinforcement for previously reinforced behavior. And we're going to decide our extinction based on why the behavior is occurring or the function. Now, one thing to note here is this is self-injurious and it's becoming a real issue. It's now bleeding, so it's serious. And we need to be careful about using just an extinction procedure for something that's self-injurious or causes harm. In this case, how are we going to put this on extinction? Well, we can either do it automatically and block the sensory gain, or we can do it attention-wise. Either way, because it's self-injurious, we need another component to treatment. So let's analyze our answer choices here, okay, and find the one that is not an acceptable extinction procedure. A, the girl's fingernails are cut down every morning before going to school. So if her scratching behavior is automatic and she, let's assume it feels good, or she likes to scratch herself, or she likes to make herself bleed, whatever it might be. If we cut her fingernails down and she's not able to get that sensation, there's a potential that this could function as extinction. So this would be decent, plus it would prevent this injury. So A is pretty good. B, the girl is made to wear mittens at school. Similar to A, just in a different light. If we put mittens on her hand, she can no longer scratch herself, and especially she can no longer make herself bleed from this repeated contact. So both are good in preventing outright the injury while also preventing the automatic sensory experience. So we're really killing 2 birds with 1 stone. Behavior's on extinction, and we're preventing the injury. But the key there is she can still do the response. She can still try to scratch herself, but no longer will she get that sensation. So it's not technically response blocking. C, each time the girl scratches her face, the teacher avoids eye contact or acknowledging her. Now, what's the issue here? Well, if the girl scratches her face to get attention, we withhold attention, have no other plan in place, that behavior is going to go through an extinction burst, and scratching is likely going to get worse. So C is very dangerous. You would not want to do C. D, the girl is provided reinforcement every 10 minutes. She does not scratch her face while the scratching is ignored. Good. D is using a differential reinforcement procedure, which includes extinction. D would be great. A and B are targeting the automatic function plus preventing injury. D is targeting the attention function, right? Plus trying to prevent injury and teaching or reinforcing other behaviors, right? A DRO. The problem with C is it doesn't prevent the injury, and it's likely going to make the self-injury worse. So of the following, which would not be acceptable, well, C. C is dangerous. It's likely to cause harm to the young girl, and it's not likely to stop the behavior from occurring quick enough. A student does not receive much attention at home, so at school he is constantly seeking out attention from adults. He will scream, throw things, and elope for attention. Matching law indicates which behavior will occur the most frequently. Pretty easy question. What does matching law say about behavior? Well, it says behavior is going to occur at the rate that it receives reinforcement, right? If one behavior receives reinforcement every 2 times and another receives it every 4 times, then that first behavior is going to happen twice as much as the second. That's what matching law says. So if we have 3 behaviors, screaming, throwing things, and eloping, which behavior is going to occur the most frequently, according to matching law? A, whichever behavior contacts reinforcement most frequently. Well, of course, right? If screaming gets the most reinforcement, it's going to happen the most. And throwing things and eloping, whatever their schedule is, that's going to dictate when that occurs as well. But A pretty much sums it up. Whatever behavior contacts reinforcement most frequently is going to occur most frequently. B, whichever behavior produces a reinforcer of the highest magnitude, is not necessarily about the highest magnitude, because if that reinforcer is only produced once a week, behavior is not going to happen as much as another one that's reinforced every day. Notice how we are going through each answer choice and identifying which ones are wrong, even when we know the right answer. You must do that every single time. C, the behaviors will occur equally, but cycle at random times. The only way they'll occur equally is if they receive equal amount of reinforcement. And then D, the behavior will change at home relative to how the behavior changes at school. D is much more in line with behavior contrast than matching law. Matching law says, out of these 3, whichever behavior contacts reinforcement most frequently is going to occur the most frequently. Consider painful stimulation, like electric shock, as an establishing operation. What is the most likely outcome in terms of value-altering and behavior-altering effects? So remember, MOs, motivating operations, alter the value of consequences and temporarily evoke or abate behavior. So if we have this painful stimulation as an establishing operation, what's going to happen? What's an establishing operation? So it's going to increase the value of a consequence and evoke a behavior. So A, a decrease in the value of the behavior that led to the painful stimulation. So be careful here. The value of the behavior doesn't decrease. The value of the consequence increases or decreases. The behavior is evoked or abated. That wording is very tricky and very, very important, okay? The behavior doesn't change in value. The consequence does. B, an increase in the reinforcing effectiveness of pain reduction. Sure, right? If you're being shocked with electricity, the consequence of pain reduction is quickly going to increase, or the reinforcing effectiveness, the value of shock reduction, of pain reduction, is quickly going to increase, right? So B is very true. Electric shock is really, really increasing the value of pain reduction. C, a decrease in the current frequency of behavior that has been reinforced by pain reduction. Well, the frequency of behavior that reduces pain is not going to decrease. It's going to increase because we're trying to achieve pain reduction. And then D, a decrease in the reinforcing effectiveness of pain reduction. Just the opposite, right? If you're being electrically shocked, the value of pain reduction is going to increase flat out, especially because we know it's an establishing operation. So what is the most likely outcome in terms of value altering and behavior altering effects? Well, B, an increase in the reinforcing effectiveness of pain reduction. Make sure you understand this question and why the other ones are wrong. MOs can be complex. They give people a lot of trouble, but they're really one of the fundamentals that guide everything else. So you need to learn these very early on and have a very strong understanding of what they are. You, a behavior analyst, sit down with some stakeholders to discuss progress on their case. At the end of the meeting, you inform them that they will receive a written report 7 days from now at maximum. What obligates you to meet this deadline you have set for yourself? Now, the nice thing about being a behavior analyst is a lot of times you have a lot of autonomy, right? You have a lot of freedom, a lot of independence. However, when you set deadlines, you need to meet them. Why? What obligates you to meet those deadlines? A, the insurance company. Well, sometimes, but in this case, nothing is said about the insurance company. It's a stakeholder meeting. Don't assume, right? And if we're not talking about insurance, we can't just say, well, the insurance company, they're not involved. B, your state licensing board can revoke your license for missing the deadline. Well, not necessarily, unless your state licensing board specifically states that you need to meet this 7-day window for this stakeholder. That isn't necessarily true. C, the BACB expects you to meet your deadline. Yes, the new ethical code explicitly states if you set a deadline, you meet your deadline. You are bound by our ethical code to meet that deadline. D, legally, you must meet this deadline. No, the ethical code is not a legal document per se. Now, we have to follow it. So if you don't follow it, you will be in trouble, right? So legally, I guess speaking, you need to follow it. But as far as the law goes, you don't have to meet this deadline. What obligates you, though, is the BACB and the ethical code the BACB sets out. Finally, which of the following is not a primary default antecedent intervention? Okay, more of a fluency question, kind of a knowledge builder. When we talk about default antecedent interventions, we mean interventions that don't take into account controlling variables, right? So you can just use them, they're defaults. A, non-contingent reinforcement. Well, to use non-contingent reinforcement effectively, we need to know the controlling variables, so it's not going to be a default. B, antecedent exercise. Yes, that is a default antecedent intervention. C, restraint. Again, yes, default antecedent intervention. And then D, enriched environment. Yes, B, C, and D are all default antecedent interventions. Now, you may know that, you may not. This is a knowledge builder question. We want to expose ourselves to as many different ideas as possible. In this case, what is not a primary default antecedent intervention? Well, A, non-contingent reinforcement, because with non-contingent reinforcement, you have to know what your controlling variables are. Fantastic. Thank you for watching. Sorry for the cold. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials. Work hard, study hard. See you soon.